concerned about catching coronavirus but are unwilling to change their behaviour or take more safety precautions. As it stands, just under half of the US population is jabbed. This reveals just how hard it may be to reach herd immunity. Well, let's bring in Mallory Newall, one of the authors of the poll and Director of Public Affairs at Ipsos. Also with us, our regular guest, Republican analyst and former advisor to President George W. Bush, Ron Christie. Hi to you both. Mallory, I'll start with you. What will it take?
Hello there.
Hi. What will it take to convince those hardcore vaccine skeptics?
Well, that's a great question, and I think our poll illustrates just how big the holdout is among those so-called skeptics. And we're seeing that a number of things, from giving workers paid time off to making the vaccine available at your doctor's office, is just not really reaching those that need to be reached.
Ron Christie, you've been in the White House. How do you reach hard-to-reach people?
Good evening to you, James. I think the thing from a White House perspective is using the White House Office of Media Affairs. In other words, to not use the national media, but to break it down, to talk to people in Toledo, Ohio, or to talk to people in Pennsylvania at the local markets and say, this is a very important message that is coming from Washington, but we wanted to talk to you directly. There's so much work that needs to be done, and Mallory and her team are to be commended for the poll that they put out in the field, but with only 49% of Americans who are fully vaccinated, there's a lot more that the White House, state and local leaders need to do to make sure more Americans have it and more Americans finally reach herd immunity.
Well, let's start looking at some of the people that the White House has deployed. First of all, there was Olivia Rodrigo, the young recording artist who's hugely popular, Mallory, with young people. Did that help connect with younger people, her appearance at the White House?
It doesn't appear to. That was one of the things that we asked about, whether a celebrity or a public figure that you liked, if they were to endorse the vaccine, would that make a difference? And for a vast majority, more than 3/4 of unvaccinated people, they said no.
Wow. I am surprised by that. Well, it wasn't just Olivia Rodrigo being deployed or going to the White House. Someone decided to give a message from his own studio. Let's have a look.
Please take COVID seriously. I can't say it enough. Enough people have died. We don't need any more death. Research like crazy. Talk to your doctor, your doctors, medical professionals you trust based on your unique medical history, your current medical condition, and you and your doctor make a very important decision for your own safety. Take it seriously.
If Olivia Rodrigo didn't break through to people, do you think Sean Hannity will have?
Well, let me take that. I've been friends with Sean Hannity for over 20 years, and I can tell you that he reaches tens of millions of Americans every week in his radio program and his television program. So for a lot of people in predominantly southern states, a lot of people don't want to take the vaccine. Hearing something from that magnitude from Sean Hannity, I think that actually might move the dial a little bit to get people to talk to their doctor, talk to their physician, and consider getting a vaccination.
Can you think?
I would agree, and the message that he's using, if I can jump in here, the message that he's using actually points to one of the more effective ways to get people on board, according to our poll. First, we know that news consumption is incredibly important in terms of a trusted messenger and where people are getting their information about the vaccine. So that's first. And second of all, if you notice, he says, talk to your doctor, talk to your primary care provider. And that's the one thing that makes the most likely unvaccinated people willing to at least consider getting the jab.
Dr. Fauci said on TV recently, you probably would have seen this, he said we'd still have smallpox and polio in the United States if the current level of misinformation existed decades ago. Ron Christie, I'm fascinated by this. When did vaccines become political in the United States?
Well, it seems with this particular strain of COVID that it has become political in the United States. But I would take this from a different tack, James. I look at this of when I got my vaccination a couple of months ago, of the number of people of color, African Americans in particular, who thought either A, this was a Tuskegee experiment that was being performed on them, and B, that this was an opportunity for the government to insert a chip to track their every movement. I think people need to recognize they need to trust their local officials, but there's so much disinformation out there, misinformation out there, particularly with people of color, that we still have a long way to go in this political climate.
Mallory Newall, what about simply paying people to get vaccinated?
That's a great question. It's not one that we've explored thus far. I think we're planning to in future waves of this research, though we did ask employed people if you got paid time off from your employer to receive the vaccine. And that, along with getting it at your doctor's office, is one of the leading contenders, right? And ultimately, though we see that a vast majority of the unvaccinated say that they're not likely to get the vaccine under any of these circumstances, at the end of the day, you are trying to figure out who is movable and how we can get them there.
When you've got the next poll, let us know. Mallory Newall and Ron Christie, thank you to you both so much for joining us.